Juan Soto is moving from the Yankees to the Mets, reportedly with the biggest contract in sports history of however many hundreds and hundreds of millions of dollars. I think that's absurd. That's absolutely absurd. Baseball is irrelevant. Baseball is not what it once was. And in the end, you know who's going to pay for those salaries? You and I, eventually. It's coming our way. Football players don't make that. One of the things I've said about baseball all along, baseball to me is irrelevant because they don't have salary cap. There are 30 teams, and at the beginning of the year, any given year, there's probably 6 that realistically have a shot at the World Series. And there's no parity. There's no chance for some of the little guys. They need to get that fixed, and that will help baseball. It's my opinion. It's Westside Jeff in for Chris Kroc. Tonight on News Talk 820 and 93.3 FM WBAP. If you want to weigh in, you can do so. 800-288-9227, 800-288-WBAP. Also follow me across Westside Jeff. I get a lot of messages during the show across Facebook, X, and Instagram at Westside Jeff. Talk about the United Healthcare scenario. The CEO was gunned down, murdered last week in New York City. Just tonight, as Lori Waffenschmidt in the newsroom identified, the suspect has been booked. He was caught today in Altoona, Pennsylvania, just about 250 miles or so west of New York City. He will be moved eventually back to New York, and they will dig for more evidence and build a case against him. But one of the things that their authorities are struggling with at this case is this guy has, in essence, become a little bit of a pop culture icon. He's got some fame. People across social media want to donate to his defense fund. It stuns me that's the case, and it's sick in a world that needs some healing. I mentioned a minute ago that this is what makes this story interesting. Is it's about some are calling it corporate greed of health insurance companies. Some are saying it's the rich versus the poor. Some are talking about injustices. You know, my overall thought on this, on healthcare, it hit me yesterday and today over the course of the weekend. You don't have to have healthcare. You can self-insure. For those who don't like it, for those who are angry about it, for those who are pissed off at what's going on in healthcare these days, you know what? If you don't like it, self-insure. You don't need insurance. You don't have to have it. Nothing in the world tells you got to have it. You can go to any healthcare provider you want just so you can pay the bill. Bottom line. So you don't have to have it. And by the way, if you have an employer, you don't like your employer's plan, I believe, I'm not totally sure on this, you could sign up for Obamacare. So you're not mandated. You're not forced into it in essence. You've got options. If you don't like it, choose another option and quit your bitching. My name is Jeff. It's Westside Jeff in for Chris Kroc. You want to argue about it? You want to tell me you like what I'm saying? 800-288-9227, 800-288-WBAP. I contend that part of what's going on right now, that the laws, mandates, and regulations have given rise to a myriad insurance of market grievances, and it's been brought on in part by Obamacare. I find it interesting that progressives are at last acknowledging that Obamacare is a failure. You see, they aren't doing so explicitly, of course. They're not coming out and saying that. But their social media posts against insurers, their social media rage and outrage against insurance companies, against United Healthcare and others, triggered by last week's murder of the United Healthcare CEO Brian Thompson, suggests as much. CBS News medical contributor Celine Gounder said during a Friday segment on the roasting of health insurers, she said, "We've gotten to a point where healthcare is so inaccessible and unaffordable, people are justified in their frustrations." Now think about that for a moment. If healthcare were truly so inaccessible and unaffordable, people are justified in their frustration against health insurers. Isn't that a little bit of a statement on Obamacare? You see, Gallup survey found or released on Friday affirms that the sentiment finding that only 44% of Americans rate the U.S. health care good or excellent. That's down from 62% when Democrats passed Obamacare in 2010. So in 2010, before Obamacare, people felt better about health care being good or excellent than they do today. Think about that for a moment. As a country, as a whole, we think health care, we felt better about health care being good or excellent in 2010. It's down by about half since Obamacare passed in 2010. A 28% rate the country's insurance programs, health insurance program coverage, highly. That's an 11-point decline. Obamacare may rank as the biggest political bait and switch in history. That's my thought on this. People liked what they had in 2010 before Obamacare. When I talk health insurance and healthcare system, they like it a lot less now. Remember Obama's promise that if you like your health plan, if you like your doctor, you could keep them. Do you remember Obama saying that? Oh, I'm sorry. That's just not the case. How about his claim that people with pre-existing conditions would be protected? Do you remember that? Hell, he went out, and when people feared Obamacare, he kept going back to that good old standby of, you know what, if you've got pre-existing conditions, you'll be protected. Well, that's not true either. Now, the biggest lie, however, was that health care would become more affordable. Do you remember that? Obama has touted all along. Healthcare, this gives accessibility to healthcare to everyone. It protects pre-existing conditions, and it makes it more affordable for everyone. Lie, lie, lie. Now, I do grant Democrats this. The law has advanced their political agenda, their goal of expanding government control over insurers, because that's exactly what it was. Obamacare wasn't about the consumer. It wasn't about making it better. It wasn't about making it more affordable. It was about more control of insurance companies. And in return for lavishing Americans with subsidies to buy overpriced, lousy products, that's what it was about. And I draw a conclusion to that, to something going on today in this current administration. It kind of feels like Obamacare Part 2, but it's not really health care that they're attacking. It's Democrats are deploying the same kind of BS, the same kind of crap to get automakers to produce more electric vehicles. So it's the same old playbook. This time it's electricity and electric vehicles. Obamacare has not been successful. Obamacare has not made it cheaper. Obamacare has not improved coverage. Yet what we're dealing with this United Healthcare scenario, I contend that is a strike against Obamacare. Now, they're not tying it together, but we need to do that. Talk radio needs to do that because it's I think, a byproduct. What happened this last week with the frustration towards health insurance, the frustration towards United Healthcare, I think is a byproduct of years of failure of Obamacare. That's my opinion. That's my thought. I want to hear yours. You can hit me up across social media at Westside Jeff. Facebook, search Westside Jeff. Twitter, now X, at Westside Jeff. Also on Instagram. Or you can pick up the phone and call. Garrett's standing by, ready to take some calls at 800-288-9227. 800-288-WBAP. Your thoughts on what I'm saying. My name is Jeff. It's Westside Jeff. And for Chris Crock on News Talk 820 and 93.3 FM WBAP. The name is Jeff. It's Westside Jeff. Garrett and I were talking, my producer Garrett Tarango and I were talking, and he said phones, a lot of phone calls here in the last hour or so, but everybody voicing their opinion with him. didn't want to go on the air, and I appreciate their opinions. Generally, he said the last call was a woman that called and said, you know what, I agree with you on the Obamacare thing and part of the frustration going on, but people don't want to go on the air. That's okay. You can hit me up across social media if you want to weigh in on that, at Westside Jeff, or feel free to call if you want to go on the air, 800-288-9227, 800-288-WBAP. The name is Jeff, Westside Jeff, and for Chris Kroc. I find it interesting to me that progressives are finally acknowledging that Obamacare is a failure. And I contend that the events we've gone through over this last week with the assassination of Brian Thompson, the CEO of United Healthcare, in part has been fueled by failed policies for the last 14 years of Obamacare. You see, on Friday or over the weekend, a CBS News medical contributor, this was on Friday, went on a segment that was talking about the murder of United Healthcare CEO Brian Thompson. And she said, we've gotten to a point where healthcare is so inaccessible and unaffordable, people are justified in their frustrations. Now, I think generally as you say that comment in social circles, I think a lot of people would agree that healthcare is very expensive, in many cases unaffordable, that it is hard to get great healthcare coverage, literally that covers everything. Those days are long past. And people are rightly so frustrated over what they're dealing with within their employers or the VA or government, but healthcare is a challenge. And that's why I think this conversation is going to be a national conversation that's going to continue for quite some time. So for a CBS News reporter, the person that covers health, medical contributor, for someone like that to come out and say that ought to tell you a little something. And it goes along with some of the studies I've seen about people who feel that they felt that in 2010, before Obamacare, they had better access to health care than they do today, that health care was better then than it was today, and that the insurance opportunities were better than they are today. 28%, a mere 28% rate this country's insurance coverage highly. That's an 11-point decline prior to Obamacare. For that reason, you can't draw any other conclusion than Obamacare may rank as the biggest political bait and switch in history. It was all about, remember what Obama said. Obama said all along that it was going to be a promise of you can keep your own doctor. That didn't happen. It was going to be a promise that pre-existing conditions would continue to be protected. That hasn't happened. And he also said that it would become more affordable. That's how he sold it, more affordable. That didn't happen. You see, Obamacare had nothing to do with truly health care. It was trying to cap health insurance and put more emphasis on health insurance companies. I contend health insurers today are operating out of the playbook based off of Obamacare of 2010. So Democrats did advance their political agenda. They did advance their political goal of expanding government control over insurers. And in return for that, it's gotten worse. It's more overpriced. The products are not as good. The fact is, government doesn't solve problems, and that's a great example. By the way, I mentioned a moment ago, we're seeing the same playbook play out the last year and a half, 2 years in the Biden administration with regard to the Biden administration forcing automakers to produce more electric vehicles. They're deploying the same BS to get automakers to do that, and that's a failed policy. Now, at the same time that Obamacare's issue, at the same time during all of this when it's going on, Obamacare's perverse effects are really fueling public rage against insurers and support for a single-payer system that would eliminate them. Now, Obama and his chief architect of the Obamacare law, his name is Peter Orszag, they got to be smiling about right now, because Orszag, now CEO of the financial services firm Lazard, has dined out on advising health insurers on mergers, and he says that we're spurred on by the laws and regulations. How convenient. So they write the law, Obamacare. The guy goes into financial services market and makes a killing by advising health insurers on mergers and acquisitions. The U.S. is spending $2 trillion more in health care today than in 2010. $2 trillion more. Yet Americans aren't healthier. I challenge you to this. Do you think that Americans today are healthier than they were in 2010? If so, you're misguided. My name's Jeff. It's Westside Jeff. I'm in for Chris Crock. You got to weigh in on this. 800-288-9227. 800-288-WBAP. You can also hit me up across social media at Westside Jeff. The reality is mortality rates for 25 to 64-year-olds for major medical causes such as hypertensive diseases, diabetes, neurologic conditions, they climb between 2009, which is prior to Obamacare, to 2019. They've continued to rise. Frustration that the U.S. is spending more money for worse outcomes within health insurance and health care. It's a similar phenomenon that's also going on in K-12 education. It's helping to drive the whole Make America Great Again, the whole Make America Healthy Again. That movement, that helped elect Donald Trump. Bigger government, the reality is bigger government has benefited the health industrial complex, but not Americans. It's benefited big corporate education, but not Americans. Our kids, K through 12, are being left behind. It's interesting as Trump announced Linda McMahon as Department of Education. I've seen all kinds of stuff across social media against it. And all I could think about was, you know what? Blow it up. Change it. It's not working today. It's not working. We are failing. Our education system is failing Americans. Maybe not in Highland Park. Maybe not in University Park. Maybe not up in Salina. But it is in Dallas schools. It is in San Antonio schools. It is in Houston schools. Big cities are failing their kids. And the same in the health industry, health insurance. It's failing in part because Obamacare. And I think what we're seeing is some of Obamacare's side effects coming into play. That's part of the frustration with what's going on in America today. My name's Jeff. It's Westside Jeff, in for Chris Crock. You can hit me up across social media at Westside Jeff. You can also pick up the phone and dial 800-288-9227. That's 800-288-WBAP. Got to hit Bob in the Hour News, and on the other side of it, we'll continue this conversation. My name is Jeff. It's Westside Jeff. In for Chris Crock on News Talk 820 and 93.3 FM WBAP. I contend some of the frustration going on across this country right now over the healthcare and insurance industry with regard to what's happened with the CEO of United Healthcare. I contend that part of that is a rebuke on Obamacare. It really is. When you think back to 2010, before Obamacare kicked in, frustration, the U.S. spent $2 trillion more in healthcare today than in 2010. Yet Americans just aren't healthier. Frustration that the U.S. is spending more on health care and getting less out of it for worse outcomes doesn't bode well at all. Listen, if the goal were to help Americans, and the reality is Obamacare wasn't about truly what he sold it as. It was about trying to regulate insurance companies, trying to regulate it all. It was single-payer system is what he was trying to get to. If the goal were really to help Americans with costly health conditions, it would have been far simpler and a whole lot less expensive to boost subsidies for states' high-risk pools. But that just wouldn't have accomplished Democrats' actual goal, which is turn everything into a de facto public utilities and jerry-rig halfway through towards a single-payer healthcare system. That would not have met his criteria. That's my opinion. I want to hear yours. 800-288-9227, 800-288-WBAP. That's my number. You can call me like Gregory from Southlake. Gregory, good talking to you again, man. Thanks for calling.
Hey, Jeff. Good to be with you again. I think there's a lot of collusion going on between the drug companies and the insurance companies. The drug companies charge more, the insurance companies pay less. And I can give you a perfect example of that. Today I filled a prescription that fortunately, because I had already met all my deductibles from my Medicare drug plan, I got out for free. But they were charging the drug was priced at $879, for which Medicare would pay $109. But they covered it that $109 completely because I'd already met my deductible. Now, this drug that they were trying to charge them like $800 and change for, the retail price on this 5-6 years ago was $116. That was before insurance. Okay, so and I've seen this with a lot of. I mean, I'm on Medicare. And I have Part B and Part D insurance, okay? And I would almost probably do better to self-insure because of the 4 drugs I take for my particular problem. The insurance only covers 2. And I wind up working with the pharmacy through the various discount plans they have, like GoodRx and things like that, to try to get the price down. But it's ridiculous. And the prices of these drugs have just been going up phenomenally. And even with the generics, this drug that I filled today is a generic. So, I mean, it's just there seems to be some kind of collusion, in my opinion, between. And I started to see this back when I was employed before I retired. The medical insurance would cover less and less and less, and the drug prices were going up more and more and more. And I don't know if you can blame this on Obamacare, but you can certainly blame this on. I think there's some kind of RICO scheme going on here between the two parties.
So, Gregory, let me ask you this, and I want to pose the question to our listeners of this. Okay. Everybody I talk to has frustration with health insurance, and at various different levels, whatever it is. What 1 or 2 or maybe 3 things would you change that would improve the system? What would you do differently? You're now in charge. You can change whatever you'd like. What do you change to make it better, make it more affordable, make it easier?
I think the drug prices don't reflect what the actual cost of the drug production is, plus a reasonable like, let's say 10 or 15% profit margin, especially on generic drugs. So I'd get some price control. People in Canada pay a lot less for their drugs than we do here. So we should.
It's funny you say that. I have a friend who's an anesthesiologist that he and I were talking about some drugs I'm on. I have narcolepsy. It's a sleep disorder, and some of the stuff that I've taken before is very expensive. And he said, "Get me your script. I'll because I'm an anesthesiologist, I can order it for you out of Canada. I'll get it there." And he looked into it, and it was 1/10 of the cost of getting it here.
Right. That's because Medicare is not negotiating with the drug companies in the same way that the other governments do, and the Americans wind up paying the price for the rest of the world. Look, if I was illegal, I could walk into a hospital and get all these drugs that I pay $200 to $300 a month for. I could get all these drugs for free. There's a problem too, because all these costs that the illegals are imposing on the medical industry are being picked up by you and me when we go to fill a prescription, or when we go to the doctor, or if we have to go to the hospital. We're paying for that. That's not right either. So I'd get that under control as well. So negotiate harder. The government should be negotiating harder with the drug companies to get prices equivalent to what they're letting the rest of the world pay. We need to get the illegal costs.
And you're talking Medicare at this point, right? Not when you say government, negotiate harder. You're talking for Medicare and even VA,
the Medicare drug,
right?
Right.
You're not talking
right.
for individual employers.
No. Well, look, I think the individual employers also ought to be negotiating hard too. Look, the government should be telling these drug companies whether they should be negotiating for everybody, for the employers and for the Medicare/Medicaid recipients as well, because the drug companies are just basically shafting us, okay, and letting the rest of the world pay nothing or pay significantly less. Like you said, it's a 90% price difference between what the guy could get your drug from Canada versus what you would have to pay in the U.S. Okay?
I keep coming back. I'm not the smartest guy in the world, Gregory. I keep coming back to this question, and I throw it out to the listeners. What would you change about our health insurance and healthcare system that would make it better and more affordable? And I don't know the answer to that. It's not a simple answer. I think it's a complex one. I'd love to hear people's perspectives on that. For you, it's negotiating better pricing on drug companies.
That's one. Number two is, if you want to just get the cost out of the healthcare system, stop giving it away to the illegals. And number three, I think there's probably, you go to a doctor today and they spend almost no time with you. And the reason for that is because they got to spend all this time on paperwork. And the reason their offices have 10 administrators to one doctor and one doctor and nurse pair is because of all the regulation, administration, and paperwork. We need to get that paperwork cut down as well.
That certainly sticks out to me. That's exactly what sticks out to me. There's a lot of duplicate, and I think attorneys and lawsuits and that whole thing has a lot to do with it. Threat of lawsuits too.
Well, it increases in malpractice insurance, which means you're paying for that in the medical bill.
Yep. Gregory, thanks for listening. I appreciate you calling. I appreciate your opinion on that. Thanks for being part of the show. That's Gregory from Southlake. My name is Jeff. It's Westside Jeff. Throughout the question that I wanted to get to tonight, one of the key things is, what would you change? What would you change today that could make health insurance more affordable and health care more accessible and better, that make the system better? And I don't have an answer. Something I truly don't have an answer. I'd love to hear your perspective. Our listeners are pretty smart. They're business owners. I know a lot of doctors that listen to the show. I've taken several calls from doctors. I'd love to hear from you. What would you change? What would you like to recommend? What could make the system better? What could make it work better for us? My name is Jeff. It's Westside Jeff. I'm in for Chris Crock on News Talk 820 and 93.3 FM WBAP. So there's a frustration across this country, and this whole United Healthcare story has a lot of layers to it, like an onion, that as it gets unpeeled, we're going to find out more. But in the end, I think what we're seeing is no matter who you are, whether you're an employee of a company, you're the employer, you're a medical provider. I talked to several doctors. I actually took calls from doctors on Friday night. Or you work in the insurance industry, there ain't nobody happy with it. And I think that's going to bubble up into a conversation that's tied back to politics. I think Obamacare made part of this a problem. I think there's a frustration across this country towards health insurance and pricing. The end of the day, prior to Obamacare or post-Obamacare, we're spending a whole lot more money for health care, but it's not making us healthier. And it's costing us more and we're getting less. So my question is this. What would you do? And I don't you're not supposed to, as a talk show host, ask a question you don't have the answer to. I don't. I'm going to ask the question. I'm just very real. My name's Jeff. It's Westside Jeff. What would you do? What would you recommend? What would you like to see change that makes health care better, more affordable, still provides the services? 800-288-9227 is my phone number. Let's talk to Jeff from Garland. Jeff, thanks for calling. You're on with Westside Jeff on News Talk 820 and now 93.3 FM WBAP.
Hey, how you doing tonight?
I'm great, man. Thank you for calling. What's your perspective on this?
Well, I don't really have the answer either, but one thing that I think we could do to lower drug costs is find the lowest cost drug price of a drug everywhere in the world and then not pay the drug companies any more than that for Medicare, number one. I have Medicare, by the way, and I have United Healthcare Medicare Advantage plan. It's really excellent. But my point is, not only have costs gone up and services gone down, but fraud has gone up. I was looking at the Department of Justice website, and they said in 2023 there were $2.88 billion in false claims from doctors to Medicare that they prosecuted, and they think that's just the tip of the iceberg. And then I look back to see what it was in 2010, and it was like in the millions. It wasn't anywhere near $2 billion. So Obamacare has done a lot of bad things, not only lowered our standard of care, but increased fraud and made it a lot easier for doctors with all this complicated paperwork to defraud the government.
Jeff, thank you for calling. I appreciate your opinion. I've heard that from several folks in the medical field. Exactly what you're saying is that Obamacare has increased the fraud coming across the desks of insurance companies and various entities. Thank you for your call. Paige from Springtown, you're on with Westside Jeff on WBAP.
Hi there.
Thanks for calling, Paige. What's your perspective on this?
Well, the guy that was talking about the prescription drugs, being so much higher and everything now, yeah, I totally agree with him. And, Biden just bragged on himself. I remember I've heard him, seen him on TV, heard him several times bragging specifically on how proud he is of himself, of what he did, what he's done for the prescription drugs in America, and how he's lowered the cost, to make it affordable for Americans and seniors and blah, blah, blah. Well, all I know is for me and my family, that has not been the case. As a matter of fact, I can remember after he had done whatever the heck he did, they were so proud of. I can remember going to pick up a prescription at Walmart where I always went, and I said, did y'all, because I always put the GoodRx on it for me because I haven't been able to afford health care for myself since Obamacare, by the way.
Back to my point.
Yeah. But I remember asking him, like, did you put the GoodRx on there? And they're like, yeah, that's what the GoodRx. So, I can remember after he, screwed that up, that he, bragged about how he fixed it. He just made it higher because, and that's been the case for other prescriptions too, for my husband. So, it's just whatever he did, he screwed it up. And, like everything else he touched, in the past 4 years. But, what I would do is I would go back. I hope Trump just gets rid of Obamacare, and I hope he just goes back. I wish we could just go back to what happened before Obamacare, because we thought we needed improvement, or at least they thought we needed improvement, and maybe some of us complained about it. Looking back on it now, it was great because, I can remember like working for my employer and being able to afford my premium. After Obamacare, I couldn't even afford the premium that they took out of my paycheck for me and like my daughter. I mean, ever since Obamacare, and Rush Limbaugh used to say this. He used to say, he before Obamacare got passed, he said that this is going to make your premiums go up. It's going to make the private healthcare sector, the premiums go up, and we're going to be the ones that pay. It's going to be unaffordable for, anyway. And that's exactly what happened. I can even remember him saying after it happened, Steve, this is what happened. I predicted this was happen. And he went back and like played a soundbite or something. How he sometimes would do that just to prove that he had predicted something. But yeah, just get rid of Obamacare. Get rid of Obamacare and go back to what we did after he spent billions and billions of dollars trying to come up with something that with his name on it, Anyway, that's my opinion.
Paige, thank you for calling. I appreciate you calling in. You agree. It's exactly what I said. I think Obamacare is part of the frustration in this country against insurance companies because we are spending $2 trillion more on insurance, health insurance today than we were in 2010. And the quality of what we're getting is a whole lot less. and it's not making anybody better. The confidence in our health insurance system and what's going on is significantly less than it was in 2010. Obamacare is a part of the problem with the frustration towards healthcare providers today. So they got nobody to blame but themselves. My question to you is this, and I see Chip from Florida. We'll get to you after the top of the hour news, Chip, so sit tight. How do we fix the health? How do we fix our system today? This is going to open a national conversation that's going to be frustrating for people across this country. What are the things you would do to make a better system? How would you fix it? By the way, breaking news moments ago, I got it on my WBAP app. If you don't have the app, I encourage you to download it. Go to your app store and search WBAP. Download it. It's a free app. You can listen to us on that app. But I also just got the breaking news notice said Luigi Mangione was charged with murder of UHC CEO. Details in 10 minutes, and that was about 8 minutes ago. So coming up top of the hour, Lori Waffenschmidt in our newsroom has a story on that, the details of the breaking news of Luigi Mangione charged with murder of the UHC CEO. That's coming up in about two and a half minutes. On the other side of that, after the news, we'll come back with your calls about how do we fix the system. My name is Jeff. It's Westside Jeff, and for Chris Crock on News Talk 820 and FM 93.3 WBAP.